You know what bothers me most about the government's COVID-19 vaccine campaign? It's not just that they spent tens of millions of taxpayer dollars trying to convince Canadians to get vaccinated. It's that they were doing it while simultaneously receiving reports of deaths, heart inflammation, strokes, miscarriages, and other serious adverse events following those same vaccines. And I have the government documents today to prove it.
And we know the way to do that is to get as many people vaccinated as quickly as possible. Every single vaccine available in Canada has been approved by Health Canada as being both safe and effective.
Let's be clear about what the government itself says. Officials maintain these reports of adverse events that include deaths do not automatically prove the vaccines cause those outcomes. Okay, fine. A report is not proof of causation, but it is proof of something else. It proves the government knew there were serious questions requiring investigation at the exact same time they were spending millions of dollars assuring Canadians that everything was safe and effective.
Once we get a significant proportion of the population vaccinated, that we will start to be able to look at loosening restrictions.
New order paper responses obtained by Conservative MP Kathy Wagenthal reveal that federal health officials received reports involving deceased vaccine recipients almost immediately after the rollout began. According to the Public Health Agency of Canada, officials received a report involving a deceased Pfizer vaccine recipient in January 2021. Reports involving Moderna and AstraZeneca recipients followed in March and April of that same year. The government also received reports involving spontaneous miscarriages, stroke, myocarditis, pericarditis, and heart attacks during the early months of the vaccination campaign. And again, federal officials say no causal relationship had at that time been established. Okay, but weren't people wondering? And here's where things get interesting. While those same reports were coming in, the Ottawa Liberals were spending an astonishing amount of money promoting vaccination. Government records show taxpayers funded at least $46.7 million worth of vaccine advertising and promotion between 2021 and 2023. There was also an $11.3 million, quote, ripple effect campaign, a $5.3 million Ask the Experts campaign, a $4.9 million worth of education and build trust campaign, a $7 million campaign aimed at children, and even a taxpayer-funded social media influencer campaign costing more than $132,000. Let's just think about this for a second. The government was literally paying influencers to shape public opinion about health policy, about vaccines, because apparently CanCon celebrity endorsements and TikTok-style messaging became a legitimate public health strategy. Now, the official explanation is that these campaigns were intended to provide Canadians with a science-based information campaign about vaccine safety, effectiveness, side effects, and eligibility. But did you know that one of the side effects being reported was death? Here's the question nobody in Ottawa seems eager to answer. How much money was spent investigating the risks? How much money was spent studying adverse events? How much money was spent trying to understand the reports that were flooding into federal databases about injuries? According to Health Canada, they don't know how much money they spent investigating the risks, or at least that's what they told Parliament. When asked how much money had been spent investigating vaccine risks and adverse effects, Health Canada responded that the information is not tracked in a centralized database and could not provide a comprehensive figure. That's absurd. The government can tell you down to the dollar how much it spent trying to convince you to take a vaccine they were getting reports about. It can tell you how much it spent on influencers. It can tell you how much it spent persuading people, but it can't tell you how much it spent investigating the potential harms. And it seems to me the potential harms are now the most important part.
Getting that shot really was an amazing feeling. It hits you.
It should concern everyone, regardless of whether they got vaccinated or not. And there's another important detail buried in this government's response. Federal officials acknowledged that safety signals were identified immediately during the rollout. Those included myocarditis, pericarditis, thrombosis with thrombocytopenia syndrome. In other words, the monitoring system was finding enough evidence to trigger formal safety reviews. The government says those findings eventually led to updates in vaccine recommendations and changes to product monographs. So the safety monitoring system was detecting issues. Warnings were being updated. Recommendations were being changed. Yet, the public messaging machine kept rolling with the same old safe and effective messaging.
There's an internationally agreed upon simplified dosing schedule now. So we won't see the worst primary series as much or booster. And it's not quite stabilized yet, but the idea is that we'll get to a place where it may be much like the flu vaccines, where people may be on a regular schedule getting an updated vaccine. And so really, I think there's more benefit just talking about the latest vaccine or the updated vaccine rather than going back to years ago when we were talking about your very first 2 doses or speaking about boosters. I don't mind the word booster because it actually does talk about what the vaccines, additional doses of the vaccines do for the immune system.
Millions upon millions of dollars continued flowing into campaigns designed to increase confidence and increase uptake and shame you if you were a skeptic. The point here isn't to claim every adverse event report was caused by a vaccine. The government itself doesn't make that claim. I'm not even making that claim. The point is that while Canadians were being told to trust the science, the actual science was unfolding in real time. They knew it and they kept it from us. The safety data wasn't settled. The evidence wasn't complete. The monitoring process was ongoing, and yet the Liberals in Ottawa behaved as though the conclusion had already been reached. Canadians deserved, and they still deserve, transparency. They deserved honest discussions about benefits and risks rather than coercion. Instead, what they got was a $46 million persuasion campaign. And years later, we're still learning details through order paper questions because the government never volunteered this information to the public on its own. That's not how trust is built. Trust isn't built through advertising. It's not built through influencers or slogans. It's built through transparency. And transparency is exactly what's missing. For Rebel News, I'm Sheila Gunn Reid. Going through a trove of documents like this is very time-consuming, and frequently it requires following up with access to information filings to support our work to hold the government to accountable. No, one more time, Sheila. Going through a trove of documents like this is very time-consuming, and frequently it requires follow-up filings through access to information to support our transparency efforts to hold the government to account for the things it says and does behind closed doors. Please consider making a donation at rebelinvestigates.com.